Mentioned about tests, whether a test is positive or negative. That's how we really do it in medicine these days. And the best way to check for mercury poisoning is to do a 24-hour urine. And with the 24-hour urine collection, we can see whether the amount of mercury you're excreting is greater than the amount that you should have. Some places they'll go ahead and take your fingernails or take a clipping of your hair and send that off for analysis. The only problem is some shampoos and some nail polish have mercury in them at very low levels, so that's not really a very reliable way. But usually not fatigue is the primary complaint.
Okay. The next question that I think is going to be telling is a question that has come up about directed towards polymyalgia rheumatica, but the question has to do with muscle weakness and related to polymyalgia rheumatica, but I'm wondering in this, the way this is actually several questions, maybe if we can maybe discuss myopathies to a certain degree, because they certainly can also lead to weakness. So maybe if we can just speak generally about muscle weakness and polymyalgia and myopathy.
Okay. Well, I'll leave the polymyalgia to my associate, but I'll talk about myopathies a little bit, because that's falls a little bit in the realm of a neurologist. And what is a myopathy, first of all? That's the first thing. A myopathy is a disease of the muscles. Okay? So that's what a myopathy is. Then it gets broken down in many ways. They're congenital diseases of the muscle. These are things that you inherit, and that's actually fairly common. And those we do very bad at treating, or very poorly at treating, I guess is the correct thing to say. And you can think of Duchenne's muscular dystrophy. Everyone's heard of that. That's a form of myopathy. There are other forms of myopathy where you have what we call eosinophilic